Good morning, everyone. It's 11:30 on a beautiful Wednesday. My name is John Nelson, and I am with the communications team at Nuvance Health, and we are here for our weekly COVID-19 vaccines Q&A. I am joined by Dr. Valerie Cluzet. Hi, Valerie. It's nice to see you. Valerie is one of our first guests a few weeks ago, and we're bringing her back this week to talk a little bit about who should get the vaccine. So Valerie, thank you for joining us. Could you tell us a little bit about yourself?
Yeah, so I'm an infectious disease physician, and I'm the medical director of infection control and antibiotic stewardship, which just means using antibiotics appropriately for the legacy Health Quest system. So our Nuvance West, I guess we're calling it these days.
Okay.
I'm here to talk about vaccines, one of my favorite topics.
We love the topic. Yes, we do. And we were here, really to get folks, excited about it, because this is a big week for vaccines, right? And why is that?
So as of yesterday, New York State has expanded eligibility for vaccines for everybody that is under the authorization, which means that anybody 16 years of age and older is eligible to receive a COVID-19 vaccine. So that's really exciting. It's ahead of schedule that they had determined by this sort of May 1st deadline. So I think it's great, and I'm hearing, at least through the grapevine and anecdotally from friends and family members, that it's getting easier and easier to make these appointments to get the vaccine. So that's great.
Right, supplies increasing, and right now there are 3 vaccines that have been authorized for emergency use. Could you tell us a little bit about those real quick? We've talked about them before, but let's just remind everyone real quick.
Yeah, I think the important piece here is really the age ranges. So important to talk about this. So right now we have authorization for use for Pfizer vaccine, which is an mRNA vaccine, Moderna, which is an mRNA vaccine as well. So they work very similarly, and the Johnson & Johnson vaccine. So Pfizer is the only vaccine that's been authorized for use in children and adults from 16 and up. So whereas Moderna and the J&J vaccines, Johnson & Johnson, are for 18 and older. So if you have, if you are or you have children in the 16 to 18 range, obviously you're going to have to look more specifically for places that offer the Pfizer vaccine. But if you're 18 and older, you can get any one of the 3. And we talked about this before, but it's important to note that although the Pfizer and Moderna are very similar in terms of their efficacy for preventing symptomatic disease, and seems to be better from numbers standpoint at preventing symptomatic disease, the outcome that we really care about is severe disease, hospitalization, deaths, and all 3 of them are pretty close to, if not 100%, effective at preventing those bad outcomes. So any one of them is a good vaccine to get, because that's really what we want to avoid, is severe disease and of course death.
That's great. And it's funny, last week when we talked to Dr. Oltekar, I asked her, like, what is the best vaccine to get? And she kind of stated, the best vaccine to get is the one that's in front of you. And that's, as long as you're eligible, you should get it. So what's this week we want to talk about, like, who should get the vaccine. And I know the generic answer to that is everybody, but let's get into some more specifics. So, you're 16, you're 18, you're 70, you're 75, you're 90, like, why is it so important that everyone get vaccinated?
Yeah, so we all know that people who are older and who have medical problems are more at risk for severe disease. That's true, but it doesn't mean that younger people are absolutely not at risk for going to the hospital or having severe disease, or even if they don't end up hospitalized. There's this new entity of post acute COVID syndrome. They keep changing the name. That's the one I'm going with. I find it easiest, the PACS, which can happen, and we don't know if it's related to severity of disease or not. So it's not without risk to get a COVID-19 infection.
Okay.
So that's reason number 1. Reason number 2 is, luckily we're getting more and more information about how these vaccines not only protect the person who gets the vaccine from getting ill, but also are very effective at preventing what we call asymptomatic illness. In other words, you have the virus, but you have no symptoms. And so you could be walking around feeling great, but you could be spreading the virus to someone else with asymptomatic infection. But we're learning more and more that these vaccines prevent that. And so by decreasing the chance of you having an infection, either with symptoms or without, you're in effect protecting other people. And some people might say, well, then let them get vaccinated. But there are obviously there are people that can't get vaccinated right now. Anybody under the age of 16, we don't even have authorization for. And there are people who are not going to respond as well to the vaccine, even if they get it. So people with immune systems who have weak immune systems because they take medications, because they're on chemotherapy, because they have immune system problems or immune system diseases, even if they get the vaccine, may not get the immune system response that's adequate to protect them. And so everybody else decreasing our chances of spreading the virus protects those people who are most vulnerable at getting the infection and also getting severe infection.
Okay. Excuse me. So we're into the specifics, who can get the vaccine. Like there are a lot of questions that come up. Let's talk about the first one. If I've had COVID, like if I'm someone who's recovered, or even if I have COVID right now, am I someone who should get the vaccine?
Yes, definitely. So although when you have COVID infection, the idea behind a vaccine is sort of to mimic having an infection so that your body develops an immune response to it. So some people might say, well, I've had it, so my immune system is already responding to it. And that's true to a certain extent. So we know that infection does give you some protection, at least probably in the 6 to 8 month range, but everything is changing as we get more and more data. But historically, and is probably the case with these vaccines, although again, everything is new, vaccines tend to give a more robust, a stronger immune system response than infection. And that's the reason we get them and the way that they're made that way. And so people who've had COVID previously would still benefit from getting the vaccine because A, it may be a stronger response, but B, it probably will last longer.
Okay. So the other one that we hear a lot about, and especially recently, is someone who is pregnant or someone who may want to get pregnant in the near future. Should they get the vaccine?
So the easier one to answer is if they want to get pregnant. So absolutely, there's no reason to think that these vaccines are going to affect fertility or any issues like that in the studies. In fact, which is going to get to the pregnant question, they don't include pregnant women. They tend not to include pregnant women in all clinical trials because you're sort of including two people rather than just one who's giving consent. However, there were some women who ended up getting pregnant who were in the trials with the vaccines. And so A, it showed that they were able to get pregnant, and B, they carried normally. Additionally, we haven't seen, you would think that there would be changes in fertility rates just with COVID infection in general, right? Because the vaccine is the same as infection or mimicking infection. And we haven't seen any changes in fertility rates related to the COVID pandemic. So I think that is a non-issue. So it does not affect fertility. So if you're planning to get pregnant, get the vaccine. If anything, we're learning that maybe moms are able to pass on the antibodies to the babies, and so the babies will be protected in their early days of life, which is great. Now, the question about pregnant women. So again, they don't include the women in the clinical trials. So we don't have as much information as some would like because they're pregnant and they're concerned. Our vaccines in general are safe in pregnant women. The women who have gotten the vaccine, pregnant women who have gotten the vaccine up until now, we haven't been seeing any adverse effects related to it. And like I said, they're even potentially, they're even passing on some of their protective antibodies to the babies. So really what it comes down to is talk with your doctor, talk with your obstetrician. If everybody feels safe and comfortable with doing it, there shouldn't be, other contraindications to doing it.
Okay. So you hear the word like high risk populations when you're in healthcare, right? So we need to really focus on vaccinating high risk populations. So who are high risk populations? What exactly does that mean?
Again, this, when you look at epidemiology, or, what sort of causes and worsens, or sort of the things that impact disease, it's all very broad, right? And so we get general ideas. So we know that people who are older are more likely to get severe disease, meaning they require oxygen or are hospitalized and have higher rates of death. People who have certain medical problems, heart disease, obesity, even, and that's been a big one that's come out, have a higher risk of severe disease and death. People with, lung issues, people with poor immune systems, all of those put people at higher risk. But that doesn't, nothing is ever perfect, and nothing ever, reads the textbook as, 100% versus 0%. So we've definitely seen cases in people who don't meet those classic definitions of high risk, and they're in our ICUs and having severe disease and not good outcomes. So although we talk about high risk in general to sort of say, okay, you're in this group, we definitely recommend you get vaccinated sooner rather than later. I don't want people to think that it's only those people that should get vaccinated, but it's why, they did sort of this stepwise rollout. We did vaccines in the people who are at highest risk and sort of generally may have higher risk of having these severe infections. But it's important for everybody.
Okay, so what if we've touched on you said lung issues or things like that. So should people who have like HIV or cancer or something like that, everyone within those should get vaccinated as well?
Yeah, so again, the clinical trials tend to exclude patients with severe immunodeficiencies, as we call it, or immunosuppression. However, there's no reason to think that they would have bad side effects or adverse events related to the vaccine. The question here is something that I mentioned a little bit before, is are they going to respond as well to the vaccine? So yes, they should absolutely get it, because if they respond, great. But we also need to be very aware as the public that there are going to be people, despite getting a vaccine, that are still going to be vulnerable and still high risk for disease, just because their immune system isn't good enough to protect them.
Okay. So, it's funny, as we've been talking, and with our topic of like who should get vaccinated, probably the easier question to answer, and I don't know if it is for you or not, but I'm going to pose it to you, is who shouldn't get vaccinated? Like who, rather than like addressing all the different audiences or all the people who shouldn't get vaccinated?
So right now, anybody under the age of 16, right? The other thing we should think about is people who have had severe allergic reactions, and this question comes up a lot. So people who just have general, allergic reactions to other things, food, stuff like that, that's less worrisome. But we do, because they're, just generally a more allergic type person, they should be monitored for a longer period of time after the vaccine. And what they found in studies of, hundreds of thousands of people who are vaccinated, is that the rate of a bad allergic reaction, at least to the mRNA vaccines, is really, really, really low. And when it happens really early. It happens within the first 20 minutes of getting the vaccine. So as long as they're being watched for for about 30 minutes, so more than the 15-minute standard that everybody else is getting, we should be able to act on it in those rare cases where it happens. However, if you've had, the Moderna and Pfizer are 2-dose vaccines, right? So what happens if you get an allergic reaction to the first dose? Do you get the second one? And if it's a severe allergic reaction, the short answer is no. And again, this is sort of anaphylaxis, throat closing, shortness of breath, immediate hives, face swelling, those types of reactions. The good news is they probably would be fine to get the Johnson. What they've shown is they're probably fine to get the other vaccine, the Johnson & Johnson vaccine, which is slightly different. So there are a couple of options, even for those people who have the contraindication because of allergic reactions. So I think the answer to your question is that there are probably very few people above the age 16 and above that should not get the vaccine.
Okay. So we actually, believe it or not, have a few questions today. One of the first is a gentleman has asked us, he says he was hospitalized with COVID in February and he has antibodies, and he wants to know how long he should wait before getting vaccinated.
So that's a good question. He doesn't. So as the guidance is that as long as you're over the acute illness, so feeling better, so that you give your immune system really a good chance to respond to the vaccine, and you're out of quarantine, so out of isolation for the Department of Health, then you can get it. Before, when vaccines were less available, we were saying, if you're going to be protected probably for at least about 3 months, so you could put it off for about 3 months if you want to, but you don't have to. So if it's available to you and you're ready to go and you're feeling great, go get it.
Okay, and I have another one. This one is a little more specific, so I know that you probably, one thing to just pose to everyone is when you ask specific questions, like if you're not a patient of ours or something like that, we can only respond kind of, generically about like what the guidance is or anything like that. But I'll read this and let you respond, Dr. Cluzet. Someone comments that she says her daughter has a bicuspid aortic valve. She's had a pediatric cardiologist since she was 1 week old, and she's 17 years old now. She took her daughter to her cardiologist for a checkup, and she asked if, her daughter should get the vaccine, and he said no, that she should wait a few years. And she feels like, his response, she says, was more political and not medical, and wants to know whether or not her daughter should get the vaccine, and also mentions that her daughter has asthma. So just throwing that out there, and, I don't know if you have any comments on that.
Yeah, I mean, it's hard to, I can't say specifically, as you mentioned, I don't know your daughter's case, and, there may be other things that part of her medical history that obviously, I'm unaware of. So I can't comment on that. What I would say is if I think that the recommendations are that, it's authorized for 16 and above based on very good, strong clinical data about safety and efficacy. And I trust those studies. I guess my only recommendation would be, if that physician doesn't feel comfortable and you're not comfortable with that response, I would, go to the primary care physician, get sort of another opinion, because, they'd have to look at the case as a whole. Sort of.
Right. Okay. Thank you. One thing that comes up a lot, and I certainly thought about it, is some people get like the second dose and they get bad side effects, as we call them, side effects, where they get a fever, they have achy, or any of those things. And then there are other people who get them and they don't have any side effects or any sort of response. So why is that? Do we know why?
We don't actually know why. I mean, so we know why people are getting the response. So, people call them side effects, and I try to encourage people not to use that word. So it's really what we call reactogenicity, reaction, right? So the effects that you're feeling when you have the fatigue and the muscle aches and the fever are your immune system responding to the vaccine, right? So when you get sick, what's making you feel terrible is actually your immune system responding to the germ. And so similarly with the vaccine, this is your immune system getting revved up by the vaccine. And so that's why you're feeling like you're sick. So it's an expected response. Now, why some people, so based on the studies, most people, especially after the second dose, are getting some sort of reactogenic response. And so, you know, it's not unexpected, but there are some people that don't. And we don't really have a good idea of like when somebody's going to react versus somebody who isn't. They haven't shown, as far as I've seen, that people who don't react get a worse response, immune system response, than those who do react. You know, I wouldn't worry about it, in other words, if you don't get a response. But what I have seen is that, interestingly, those above 65 are a little bit less likely than those under 65 to get this sort of these symptoms, and women are more likely than men to get the symptoms. So that it's still a lot of unanswered questions, but
Gotcha. So you can just use your, you know, you can be like with your group of friends, you can just compare your reactions and say like, hey, I got a fever. Hey, I didn't get anything, you know, and like, I guess bragging rights, right, among all of your friends for vaccines. Right?
And you'll see that everybody's a little bit different. You know, I had a lot of muscle aches, and, you know, my partner had, you know, a fever, and I didn't, you know, those kinds of things. So,
right. Okay. All right, so one other thing that comes up a lot, and actually the woman who commented and asked about her daughter wanted to express her thanks for addressing her question. So,
of course.
You know, one other thing that's come up a lot recently is, you know, the 3 vaccines that are authorized for use really aren't the only ones that are out there, right? There are others that are being studied, and it's really not going to be that long, and there are going to be even more vaccines that are available for, you know, emergency use potentially if they get authorized. Could you talk a little bit about, or do you know anything about any of the other vaccines that are being studied right now?
So I'd say, I'm sure a lot of people have heard about it. Probably the closest one, well, there's 2. So AstraZeneca and University of Oxford, and then there's Novavax, both of which are being studied. So AstraZeneca, both of them are being used in other countries. There's been a lot in the news lately about the AstraZeneca vaccine and possible association with abnormal clotting. They're still looking into that. So I think that's really going to determine whether it's going to become available in the US. Based on what I've been reading, though, you know, I think that in terms of our inventory for the United States, we're actually in a really good place. So even if they don't, you know, authorize a bunch more vaccines based on the inventory for the 3 that are currently authorized, we're probably in a pretty good place. Now, you know, COVID doesn't like to stick to one country, obviously, right? So we shouldn't only be concerned with what happens in the US. And so it's kind of a bummer, as they say, that, you know, if the AstraZeneca vaccine doesn't seem to pan out to be as safe as they anticipated, because it's an easy to distribute vaccine. It's a cheaper to make vaccine, and has been used globally. And so it would be a real shame if that gets, you know, taken out of the running, because it would be, you know, it would really help us from a global perspective. What sort of a corollary to your question that I'm going to add here, though, is that they're now studying, so Moderna and Pfizer are both working on the younger age groups on their studies. So we're hoping there's a study for 12 to 16, and then, you know, 18 for Moderna. And then they've just started enrolling Moderna in the 6-month to 12-year age range. So hopefully soon, in the next few months, we should have information about our kids and the effectiveness.
That's great news. Another thing that comes up a lot is, you know, we're working on ramping up and getting everyone vaccinated and all this stuff. So is this something that we're just going to have to do again, you know, next year or in 6 months, or, you know, like, is it going to become like the flu vaccine where you're getting it every year at your primary care doctor or at the local pharmacy? Do we even know the answers to those questions yet?
We know a little bit more than we did just a few weeks ago when I was on here. So both Moderna and Pfizer, again, these are two of the 3 vaccines that have been authorized, have come out with data, because if you think about when the study started, they started in the summer, so we really only have as much data as time has passed. So we don't even have a full year of data yet. But as they're accruing data, they're releasing it, which is great. I think the transparency has been really great. And so both Moderna and Pfizer recently have shown that their vaccines are effective at least to 6 months. So before, we only had about 3 months worth of data, about 112 days, I think was where it cut off. And now we're out to 6 months where they're saying still effective, still have really good levels. So it's unclear. Does that mean, the next thing that comes out is, is it going to be effective at least a year and then we won't need a booster? Or is it going to start to, the immune response die down a little bit and then we'll have to get boosters? It's unclear. The other thing that may throw a wrench in all this is a little bit are the variants, right? So as we learn more, so does the virus. And so the virus mutates, and the more it has a chance to spread, the more it has a chance to mutate and develop mutations that let it become more transmissible or evade vaccines or treatments. So if we, if we lose that race, variant versus vaccine race, then they're going to have to, and they're already working on this, develop different versions of the vaccines to cover these different variants, these different strains of the virus.
Right.
Good news is they have the processes, and they're already working on it, and it's actually a pretty easy process. Easy, I say that not having to sit in the lab, but from what they say, it's a pretty easy thing to.
Well, I was actually going to ask that because you've talked a little bit before in previous Q&As about the mRNA vaccine and how you basically can just tweak it a little bit to, create the antibodies for a variant or something like that. So it's not, it's not as complicated as just coming up with something from scratch, correct?
Right. Yeah, it's not a months or years long process. It's on the order of, 4 to 6 weeks from what they're saying.
Okay. So another question came through. This person says her husband has BAV, free surgery starting at 29 years old. He's 53 now, and he had vaccine. And this isn't a question, but she says she wanted him to get it because she thought he was one of those high-risk folks who, if he got COVID, it could potentially kill him. So she wants to, mention that and thank you for, for encouraging folks to get vaccinated and for us for doing that. So.
And thank you for your story. I think you expect us doctors to tell people to do it, but I think it's more impactful when community members and patients and say, this is why I did it, and I trust it. So thank you.
Yeah, I agree. Like one of our things that we say here is kind of what's your why, and we try to encourage people to, tell people why. I mean, don't keep it to yourself. If you believe in getting immunized or getting vaccinated, share that with family and friends, because we do want, we do want the world to get back to some semblance of normal. And, if you are someone who is eligible, you can get a vaccine appointment. It's becoming easier and easier. If you have questions, you can go to our website, newvancehealth.org, which has a great FAQ. If you want to look and see if you're eligible, both Connecticut and New York, their state websites have phenomenal, resources that can help you figure those out. Another great resource is something called vaccinefinder.org. And that, if you type in your zip code, it'll show you like every place around you that has appointments, has vaccines. It includes pharmacies. It includes, any medical practices or other places. So, there are vaccines out there. If you're someone who's frustrated that you can't get an appointment, our recommendation is just to be diligent and to stick with it, because, the faster everyone gets it done, the faster, we can get back to normal. So Valerie, we're closing up here. Do you have anything else you'd like to say to before we say goodbye for this week?
No, just, as I said, thank you to everybody who shares their stories, and and spread the word, because I think that that's you will make the most impact.
So thank you so much for joining us today. We'll be back next week, and have a great rest of your beautiful, beautiful Wednesday. Take care.